So this food, exercise, sleep, these three are most important factors. Either you have to fight or you have to flight, you have to run away. Cancer Awareness Month, we celebrate like that. It's not celebration, it's like a creation of awareness. Screening is must, prevention is must.
Welcome to BHIO Healing Talk, the official podcast of Bharath Hospital and Institute of Oncology. I'm your host Kavya, and today we are joined by Dr. Vijay Kumar, who will help us to understand technology and lifestyle, how it plays a role in cancer prevention. So, welcome you to our podcast, sir. So, doctor, we hear much about cancer these days. Is it actually becoming more, or are we diagnosing it better now?
Actually, it's both. And nowadays there are a lot of advancement in technology, and that we are able to diagnose cancer early. Like for example, CT scan agli, PET scan agli, ಎಲ್ಲ ಕಡೆ ಅವೈಲಬಿಲಿಟಿ ಇದೆ. ಅಂದರೆ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಎವ್ರಿ ತಾಲೂಕ್ ಹ್ಯಾಸ್ CT ಸ್ಕ್ಯಾನ್ ಫಾರ್ ಎನಿ ಪೇಷಂಟ್ ಕಂಪ್ಲೇಂಟ್ಸ್ ಲೈಕ್ ಪೇನ್ ಅಬ್ಡಮನ್ ಆಗಲಿ ಅಥವಾ ಕೆಮ್ಮು ಕಂಟಿನ್ಯೂಸ್ ಆಗಿದ್ರೂ ಫಸ್ಟ್ ಟೆಂಡೆನ್ಸಿ ಆಫ್ ಡಾಕ್ಟರ್ ಇಸ್ ಟು ರೈಟ್ ಇನ್ವೆಸ್ಟಿಗೇಷನ್. So with the help of investigations, we are able to diagnose them early. Initially, few decades back, we didn't have these facilities. It was going undiagnosed. ಎರಡನೇದು, we are able to maintain proper registry, what we call as cancer registry ಅಂತ documentation proper ಆಗ್ತಾ ಇದೆ. That's why we are seeing lot of increase in cases. Apart from this, yes, definitely there is rise in cancer cases. Most commonly we should blame is two things: our lifestyle. Second one, like our lifespan is increasing. Like for example, 50 years, 60 years back or 100 years back, our lifespan was hardly 40 years, 50 years. Many used to die with communicable diseases like plague agli, diarrhea agli, undiagnosed infections. ಸೊ ಈಗ ಬರ್ತಾ ನಮ್ಮ ವಿ ಆರ್ ಏಬಲ್ ಟು ಕಾನ್ಕರ್ ಆಲ್ ದಿಸ್ ಕಮ್ಯುನಿಕಬಲ್ ಡಿಸೀಸ್ ಅಂತ ಕರೀತಾರೆ. ನಾವು ವಿ ಆರ್ ನಾಟ್ ಏಬಲ್ ಟು ಕಾನ್ಕರ್ ದಿಸ್ ಕ್ಯಾನ್ಸರ್ ಸ್ಟಿಲ್. ಸೊ ಏಜ್ ಸ್ಪ್ಯಾನ್ ಜಾಸ್ತಿ ಆದಂಗೆ ಕಂಟಿನ್ಯೂಸ್ ಆಗಿ ಇನ್ಫ್ಲಮೇಷನ್ ಆಗ್ತಾ ಇರುತ್ತೆ ಬಾಡಿಯಲ್ಲಿ. ವಿ ಆರ್ ಎಕ್ಸ್ಪೋಸ್ ಟು ಸೋ ಮೆನಿ ಫ್ಯಾಕ್ಟರ್ಸ್ ಇನ್ ಎನ್ವಿರಾನ್ಮೆಂಟ್. ಸೊ ಕಂಟಿನ್ಯೂಸ್ ಎಕ್ಸ್ಪೋಜರಿಂದ ಮ್ಯೂಟೇಷನ್ಸ್ ಆಗ್ತಾ ಇರ್ಬೋದು. ಸೊ ನಮ್ಮ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್ ಆಗ್ತಾ ಇರ್ಬೋದು. ಅದರಿಂದ ಕ್ಯಾನ್ಸರ್ ಇನ್ಸಿಡೆನ್ಸು ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ.
ಸೊ ಡಾಕ್ಟರ್, ಇವಾಗ ಫುಡ್ ಬಗ್ಗೆ ಮಾತಾಡಿದ್ರಿಂದ, ಸೊ ಈಟ್ ಹೆಲ್ದಿ, ಸ್ಟೇ ಆಕ್ಟಿವ್ ಆ್ಯಂಡ್ ಡೂ ಎಕ್ಸಸೈಸ್. ಸೊ ದೀಸ್ 3 ಹ್ಯಾಬಿಟ್ಸ್ ಎಲ್ಲ ಡಾಕ್ಟರ್ಸಿಂದ ಇರ್ಬೋದು ಅಥವಾ ಯಾರನ್ನೇ ಕೇಳಿದ್ರು, ದೇ ಅಡ್ವೈಸ್ ಆಲ್ ದಿಸ್ ಥಿಂಗ್ಸ್. ಸೊ ಆರ್ ದೀಸ್ ಹ್ಯಾಬಿಟ್ಸ್ ರಿಯಲಿ ಹೆಲ್ಪ್ಸ್ ಅಸ್ ಟು ರೆಡ್ಯೂಸ್ ದ ರಿಸ್ಕ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್?
Actually, wherever I go, I say this: whatever you are is whatever you eat. Food is most important for our life. Apart from food, like one ಅಂತ ಹೇಳೋಕ್ಕಾಗಲ್ಲ, there are many factors. Food is most important in that. If we eat healthy, we live healthy. And second most important, what I give priority is sleep. Proper 6 to 8 hours of sleep is must for any person. Next, exercise. So regular daily 10 to 15 minutes or 30 minutes of exercise is most important for our body. So this food, exercise, sleep, these 3 are most important factors which help us to keep healthy. ನಾವು ಚೆನ್ನಾಗಿರ್ಬೇಕಂತಂದ್ರೆ ಈ 3 ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್ ಡೈಲಿ ಆ್ಯಕ್ಟಿವಿಟೀಸಲ್ಲಿ. ಅಪಾರ್ಟ್ ಫ್ರಮ್ ದಿಸ್ ಲೈಫ್ ಸ್ಟೈಲ್ ತೊಗೊಂಡ್ರೆ, I always say one most important thing which you have to avoid is smoking. Tobacco, smoking. If you avoid this smoking, take it from me, almost 50 to 60% of cancers what we see we can reduce. Next important, alcohol. Obviously it's very difficult to leave this. Then next, stress. All these factors which affect our human lifestyles or human life, you should avoid this.
ಸೊ ಸ್ಟ್ರೆಸ್ ಬಗ್ಗೆ ಮಾತಾಡೋದ್ರಿಂದ, ಸ್ಟ್ರೆಸ್ ಈಗಿನ ಕಾಲದಲ್ಲಿ ಇಟ್ಸ್ ಅ ಪಾರ್ಟ್ ಆಫ್ ಲೈಫ್. ಯಾರನ್ನೇ ಕೇಳಿದ್ರು ಮಕ್ಕಳಿಗೆ ಎಕ್ಸಾಮ್ ಸ್ಟ್ರೆಸ್ ಇರ್ಬೋದು, ದೊಡ್ಡವರಿಗೆ ವರ್ಕ್ ಪ್ರೆಷರ್ ಇರ್ಬೋದು, ಲೈಕ್ ದಸ್. ಸೊ ಈಸ್ ದಿಸ್ ಸ್ಟ್ರೆಸ್ ಇಸ್ ಆ್ಯಕ್ಚುಲಿ ಇನ್ಕ್ರೀಸಿಂಗ್ ದ ರಿಸ್ಕ್ ಆಫ್ ಫ್ಯಾಕ್ಟರ್?
See, stress is most important aspect in life. ಸ್ಟ್ರೆಸ್ ಅನ್ನೋದು ಇರಬೇಕು, ಬಟ್ ಟು ಸರ್ಟನ್ ಎಕ್ಸ್ಟೆಂಟ್ ಅಷ್ಟೇ. ಸ್ಟ್ರೆಸ್ ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಮ್ಮ ಬಾಡಿಯಲ್ಲಿ ಅಡ್ರಿನಲ್ ಗ್ಲ್ಯಾಂಡ್ ಅಂತ ಇರುತ್ತೆ, ವಿಚ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಇಫ್ ದೆರ್ ಇಸ್ ನೋ ಅಡ್ರಿನಲ್ ವಿ ಕೆನಾಟ್ ಸರ್ವೈವ್. ವೈ ಗಾಡ್ ಹ್ಯಾಸ್ ಗಿವನ್ ಸ್ಟ್ರೆಸ್ ಅಥವಾ ಇದು ಬಂದಾಗ ದೆರ್ ವಿಲ್ ಬಿ ಲಾಟ್ ಆಫ್ ರಿಲೀಸ್ ಆಫ್ ಅಡ್ರಿನಾಲಿನ್. ಐದರ್ ಯು ಹ್ಯಾವ್ ಟು ಫೈಟ್ ಆರ್ ಯು ಹ್ಯಾವ್ ಟು ಫ್ಲೈಟ್ ಅಂದರೆ ಯು ಹ್ಯಾವ್ ಟು ರನ್ ಅವೇ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಆಗಿನ ಕಾಲದಿಂದ ನಾನು ಹೇಳ್ತೀನಿ, ಲೈಕ್ ಆಗ ಫಾರೆಸ್ಟಲ್ಲಿ ಅಥವಾ ಎನಿಥಿಂಗ್, ಲೈಕ್ ಇಫ್ ಸಮ್ ಅನಿಮಲ್ಸ್ ಕಮ್, ಇಟ್ ವಿಲ್ ಕ್ರಿಯೇಟ್ ದಟ್ ಸ್ಟ್ರೆಸ್ either to run away from there or fight. So that stress is very important. For example, exams towali, if you don't have that stress of facing that, you will not study alva. So stress is important, but to a certain extent. But if it becomes continuous, chronic stress, it is dangerous to our health. And like smoking tara, like for example, direct relation illa. Stress causes cancer, no. ಸ್ಟ್ರೆಸ್ ಇಸ್ ಎ ಕೋ ಫ್ಯಾಕ್ಟರ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಲೈಕ್ ಕ್ರಾನಿಕ್ ಸ್ಟ್ರೆಸ್ ಆಗೋದ್ರಿಂದ ಬಾಡಿಯಲ್ಲಿ ಇನ್ಫ್ಲಮೇಷನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಇನ್ಫ್ಲಮೇಷನ್ ಜಾಸ್ತಿ ಆದಷ್ಟು ನಮ್ಮ ಆರ್ಗನ್ ಇಂಜುರಿ ಜಾಸ್ತಿ ಆಗ್ಬೋದು. ಆಮೇಲೆ ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನವ್ ಇಟ್ ಈಸ್ ದಿಸ್ ಜನ್ರೇಷನ್, ಯು ಟೇಕ್ ಸ್ಟ್ರೆಸ್ ಜಾಸ್ತಿ ಆಗ್ತದೆ, ದೇ ಗೋ ಅಂಡ್ ಗೆಟ್ ಅಡಿಕ್ಟೆಡ್ ಟು ಸ್ಮೋಕಿಂಗ್, ದೇ ಗೆಟ್ ಅಡಿಕ್ಟೆಡ್ ಟು ಆಲ್ಕೋಹಾಲ್. ಸೊ ದೋಸ್ ಇಂಡೈರೆಕ್ಟ್ಲಿ ಪ್ಲೇ ಟು ಅ ಪರ್ಸನ್. ಆ್ಯಂಡ್ ಕ್ರಾನಿಕ್ ಇನ್ಫ್ಲಮೇಷನ್ ಆಗೋದ್ರಿಂದ ಈ ಥರ ಹವ್ಯಾಸಗಳು ಅಳವಡಿಸ್ಕೊಳ್ಳೋದ್ರಿಂದ ಕ್ಯಾನ್ಸರ್ ರಿಸ್ಕ್ ಜಾಸ್ತಿ ಆಗೋದು. ಆಮೇಲೆ ಸ್ಟ್ರೆಸ್ ಜಾಸ್ತಿ ಆದಷ್ಟು ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್, ಇಫ್ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ ಕ್ಯೂರ್ ಆಗಿರ್ತಾರೆ, ಸೊ ಇಫ್ ಪೇಷಂಟ್ಸ್ ಹ್ಯಾವ್ ಕ್ರಾನಿಕ್ ಸ್ಟ್ರೆಸ್, ರಿಕರೆನ್ಸ್ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ. ದಟ್ಸ್ ವೈ ಐ ಆಲ್ವೇಸ್ ಅಡ್ವೈಸ್ ಮೈ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್, ಬಿ ಸ್ಟ್ರೆಸ್ ಫ್ರೀ, ಯೋಗ ಮಾಡೋದು, ಮೆಡಿಟೇಷನ್ ಮಾಡೋದು. ಸೊ ಅದರಿಂದ ಮತ್ತೆ ಬರೋ ಚಾನ್ಸಸ್ ಕಡಿಮೆ. There are few studies to support this.
ಟೆಕ್ನಾಲಜಿ ಅನ್ನೋದು ಎಷ್ಟು ಇಂಪ್ರೂವ್ ಆಗಿದೆ ಅಂದರೆ ಎವ್ರಿಥಿಂಗ್ ವಿ ವಿಲ್ ಗೆಟ್ ಇನ್ ಅವರ್ ಫಿಂಗರ್ ಟಿಪ್. ಸೊ ಈವನ್ ಲಾಟ್ ಆಫ್ ಪೀಪಲ್ ವಿಲ್ ಗೋ ಥ್ರೂ ಫಾರ್ ದ ಇನ್ಫಾರ್ಮೇಷನ್ ಇನ್ ಆನ್ಲೈನ್. ದರ್ ಇಸ್ ಅನ್ ಮಿಸ್ಇನ್ಫಾರ್ಮೇಷನ್ ಆನ್ ಎವ್ರಿಥಿಂಗ್. ಲೈಕ್ ಹೌ ಪೀಪಲ್ ಐಡೆಂಟಿಫೈ ಇಟ್ಸ್ ಜೆನ್ಯೂನ್ ಮೆಡಿಕಲ್ ಅಡ್ವೈಸ್?
Okay, this is very difficult to answer. Even if I want to review some thing on, like for example hospital or like a hotel, I open the Google and take the reviews. So it's a natural tendency, but when it comes to health aspect, I always advise better to go to a genuine person. I always advise them to go to a concerned doctor. For example, if you have cardiac issues, go to cardiologist. If you have cancer issues, go to cancer doctor like oncologist or oncosurgeon. They are well qualified. Or some qualified person, if they give some awareness talk, you listen to them. Otherwise, like I don't prefer them just Google symptoms and coming to conclusion. I don't suggest that. Better to go to a healthcare provider who is qualified in that and take their suggestion.
ಸೊ nowadays we hear like ಎಲ್ಲ ಕಡೆ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಬರಲಿ, ಏನೇ ಅಂತ ಬಂದ್ರೂ prevention is better than cure. Prevention is better than cure. So what does prevention really look like in a daily life?
See, prevention is better than cure. It's applicable to all. For example, even any health issues you take, like for example cardiac issues or any health related issue, elder people used to say always prevention is better than cure. See, rather than suffering, it's better to prevent. So when it comes to prevention aspects in cancer, there are a lot of things. See, cancer is, I can say it's a self-inflicted disease or man-made disease. For example, like see, if you follow healthy lifestyle, chances of the cancer coming is less, obviously. If you don't smoke, incidence of cancer comes down. If you don't take alcohol, obviously cancer comes down. See, it's all in your hands. Obviously, it's in your hands. So it's all you have to make up. You have to be strong, and you have to tell yourself, God has given this body, this life. You have to take care of it, not destroy it by smoking, eating all junk foods or unnecessary. Yeah, even sometimes I eat, but you should limit. Prevention is always better. Stop smoking, stop alcohol, stop unhealthy foods, be active. Then I think majority of diseases will come down. And one most important thing nowadays is, it's like diabetes and obesity. It's like our India is becoming this diabetic capital and obesity capital. Wherever you see pot bellies, you see pot bellies. So I can say obesity is one of the culprit for all this. Like for example, cancers, laziness, diabetes, hypertension, lethargy, in women PCOD, so many hormonal imbalances. So if you properly balance your lifestyle, I think you can avoid a lot of diseases. Everything is in your hands.
But junk will call us, come and eat me. Okay, so
One more thing I want to add in this, the junk you told. Whatever it is good or better for tongue, it is not good for your health.
True.
That I want to highlight. If tongue craves, you should think it is not good for your body.
So here is the tip. If your tongue is getting some very much taste, don't eat that.
Yeah.
But secretly eat later. Okay, fine. So cancer and the Takshana Janak first barode. It is a death sentence. Actually, cancer is a death sentence. Anda. So how true it is in these days? Because we have come up with a lot of technologies and everything.
It was true few decades back, because we didn't know how it behaves. Cancer andre ಏನು, ಹೇಗೆ ಟ್ರೀಟ್ ಮಾಡೋದು, we didn't have that technology to diagnose it, to study its history and like progression, how it progresses, how it kills. We didn't have that tools. Now we have a lot of technology, we have genomics, we know how it behaves, and we have a lot of wonderful drugs for that. And coming to surgery, we have good technology, like we have robotic surgery, as well as we can, if patient comes in early stage, we can definitely cure it. It's no longer a death sentence. Even in stage 4, for example, few cancers, definitely it's curable. But I would definitely suggest to public, like whenever you feel some abnormality in your body, any abnormal symptoms, definitely I would suggest them to go to a healthcare provider, get diagnosed early. And if patient comes in early stage, like for example stage 1, 2, definitely we can cure them. If not, we can definitely give them prolonged life. We have wonderful immunotherapy drugs. We have seen stage 4 people staying for 10 years with wonderful drugs.
So doctor, I know you're a farmer too. So I have a question for you. Is organic food is really good to health, or it's just a marketing term?
Even I didn't know about this organic farming and all. Like what I am from my grandfathers, they're all farmers. We are from the farmers family. What I've seen, like apply cow manure, proper tilling of soil, and growing the food. We used to eat raw foods like that. So of late, like since after my oncology career, I came to know that what we are eating is all adulterated. It's all contaminated with pesticides. Even farmers, it's like we can't blame them. There are no proper minimal support price for them. So definitely they want some good yield. They definitely will apply pesticides. There are a few studies, like for example Monsanto, one company like in America, they have filed $1 billion suit against them. So it's proven in few studies that pesticide definitely causes cancer. So what I suggest, like, eat what God has given, what Mother Earth gives naturally. I can call it as a natural food rather than organic food. I don't know what is like exactly, even I am confused what is organic food. I am into farming, yes, definitely yes, I love farming. What I do in my farm is definitely we have cows. We apply cow manure. We apply cow urine for as a pesticide, neem as a pesticide. So it's, I don't know about this marketing terms, but definitely what I say, you should eat what Mother Earth gives in a natural way and naturally grown way.
So we all know October is a breast cancer awareness month, but yet people oftenly research or search on internet regarding breast cancer in October itself. Is that media stories influencing them to know the breast cancer awareness? How it is only October going with the breast cancer
search? October we celebrate as a breast cancer awareness month. So every month has some cancer awareness month, like we celebrate like that. It's not celebration, it's like a creation of awareness. See, public will not know about the cancer. They always stay in a fear. Cancer term is, even it is, it scares me. Imagine about public. So, only way we have to remove that fear is creating awareness, creating, giving them the knowledge, proper knowledge. So, October being a breast cancer awareness month, we take this as an opportunity. Whole month, like, create awareness regarding breast cancer. Breast cancer is the most most common cancer in India in women, and it is killing women in a good reproductive age group, 40s, 50s. So imagine family without a woman at the age of 40. This is very painful. So only way is like to create awareness, give them a boost, give them confidence that come early, you can be cured. So this is only opportunity to create awareness. Definitely it is required. I think many hospitals are doing, including our hospitals, and it is necessary to create a proper awareness and give information, proper information to them.
Okay, one last question on this podcast. Like, if ಈಗ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಬಂದ ತಕ್ಷಣ ಎಲ್ಲಾದ್ರೂ ಒಂದು ಗಂಟೆ ಥರ ಸಿಕ್ಕಿದ್ರೆ ಅಥವಾ ವಿ ಶುಡಂಟ್ ಹ್ಯಾವ್ ಟು ಡಿಲೇ, ಆ ಏಜ್ಗೆ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡಿಸ್ಕೋಬೇಕು, ಆ ಪ್ರತಿಯೊಂದೂ ಆ ಏಜ್ಗೆ ಏನಿರುತ್ತೆ ದಟ್ ವಿ ಹ್ಯಾವ್ ಟು ಗೋ ಅಂಡ್ ಗೆಟ್ ಇಟ್ ಅಂತ. ಬಟ್ ಆಫನ್ ವಿ ನೆಗ್ಲೆಕ್ಟ್, ಎಷ್ಟು ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡ್ತೀವಿ ಅಂತಂದರೆ ಇಫ್ ಇಟ್ ಕಮ್ಸ್ ಆಲ್ಸೋ. ಬಟ್ ನವ್ ಡೇಸ್ ಬಿಕಾಸ್ ಐ ಆಮ್ ಇನ್ ಟು ದಿಸ್ ಮೆಡಿಕಲ್, then if I get something, I will go and search in online, like what is the symptoms. So I am also doing, in the sense other people also doing, like in the same way. So how people are misunderstanding by searching cancer symptoms on online.
That's why before I told, like if you have some issues, better to consult healthcare providers. Like for example, if you have lumps, swelling anywhere in the body, as early as possible come to an oncologist. Definitely they will be able to examine, do some test, then come to conclusion, rather than you Google the symptoms and being in fear. So it's not advisable. And coming to screening, I definitely suggest screening. For example, many screening methods are there, mainly for women, for breast cancer, cervical cancer. For breast cancer, we have mammosonography. In cervical cancer, we have pap smears. So these are all modalities which help us to diagnose in early stage. As I told before, if you diagnose in early stage, cure rates are better. So screening is must, prevention is must. I always encourage these modalities to public.